Welcome everybody, welcome to another wonderful episode on GoMAD with an amazing doctor with us, Dr. Nandini. She is a specialist in laser dentistry, and let's get beyond the fear of chair with her and explore what dentistry is all about in the field of laser. So welcome to our channel, Dr. Nandini.
Thank you.
Thank you so much for coming, taking
Thank you
time
for having
out
me
and
over.
scheduling yourself for us. Wonderful to have you. So before we get into details of what laser dentistry specifically is, could you tell us a little more about yourself?
Okay, I'm Nandini and I've been practicing here in Bangalore since the past 15 years. I've worked with multiple hospitals throughout my career. I love my dentistry, I love doing what I'm doing. So that's where we are here today.
Amazing.
To talk. I have specialized in quite a few things. I largely specialize in lasers and I do specialize in soft tissues. Basically, that's the gums of your teeth. More than the teeth, I specialize in your gums because those are the building blocks of your tooth itself.
Okay. How did dentistry happen?
How did dentistry happen? That's a wonderful question. All right, so from the time I remember, I've always wanted to be a doctor. All right, so that's how it's always, from the time I was in my probably 8th, 9th grade, I always remember, I always strive towards it. I'm a completely meritorious merit student, you can say. I never had a paid seat per se, so I'm pretty artistic that way. I love working with my hands. So like they say, a dentist is a doctor and an artist together. So probably that was the combination that worked, and that's how I love what I'm doing.
Very nice. I mean, that's a beautiful way to put it out. I've probably not heard that from a lot of people. Many of them, in fact, they choose dentistry because they didn't crack an MBBS seat.
True, very
This is
true.
a general notion that people have. So it's lovely to see you having that passion and then choosing what you're doing, right? Diving into the topic, right? Could you tell our audience what really laser dentistry is?
All right. Laser dentistry is a part of general dentistry that we've all heard of multiple procedures. Like say everybody's heard of cavity preparation or decay in their teeth. They've heard of wisdom tooth which is hurting, which needs to come off. These are all treatments that we've been doing for years. Using older techniques of treatment. Laser is an advancement that we see to do the same treatments.
Okay.
It's not that with laser we've invented a new procedure or anything. No, it's the same set of procedures that we are doing. But yes, it's bloodless and painless. So most of the patients, we can do multiple procedures, even avoiding anesthesia when we're using lasers. So that fear of that needle goes away.
Okay.
And we're able to get much better results when you're using a laser, which is an additional aid to the treatment that we are regularly doing.
Okay. So, what kind of issues can people come to you with?
For lasers
Yes.
or in general?
No, for lasers.
For lasers. All right. So, starting out from very basic things, if you look at it, lasers, if you ask me in terms of a speciality or a specialization, what it does best, I would say it does best gum therapy or gum treatments. So, forever, from the time probably years, ages, eons before, for a gum therapy or a gum treatment that was required, which basically involved inflammation of your gums. Pyorrhea, it was known before, and now it's known as periodontitis. So to treat periodontitis, the only way of treating we had years ago was to open up the gums, to do something called as a flap surgery. When we open up the gums, we're able to see your bone below, we're able to see the soft tissue below, curette the area, clean up that area, put it back and stitch it up. All right, and this would never happen one shot because we can't open up the entire mouth and close it up, because mouth is one organ which, irrespective of whatever we have to use, there's no way of plastering it and closing it up.
True.
Right? So with lasers, when we're talking about pyorrhea or periodontitis, we're able to finish the same procedure in a single sitting. It's bloodless. I do not need to open the gums or open a flap. The results of treatment are amazing for the fact that there's something called as an attached gingiva that we have, which basically holds the gum back onto that bone. But when we are opening it out for a flap, we are losing that attached gingiva, because we are actually opening out that attached gingiva and then cleaning up that surface. Right? So with laser, the laser filament is about as thin as your hair filament, a few microns in thickness. So it's able to reach down way below into the surface of your gum, clean up or curate the entire area. What we do under visual thing, when we open up the gums, we are able to clean it with lasers. We're able to eliminate the microorganisms, because it's it is able to kill your microorganisms. Lasers are able to kill your microorganisms, selective microorganisms which are disease causing microorganisms. Laser is able to target and kill. So we're able to clean out that entire surface, and without a stitch, without a bleed, we're able to complete your treatment. Patient is able to get back to his regular routine instantaneously. Procedure lasts about an hour, hour and a half. Patient is able to get back to his office and work very immediately, just after the procedure.
That's a wonderful advancement.
Yes.
Right? So how does it traditionally happen? Like you cut out and it's a surgery?
Yes, it's a surgery. It's called as a flap surgery. We open up. So we raise a flap, open up the flap, look at the bone, clean the bone, curate. That is basically remove all the dead and diseased tissue. That is why that inflammation is there. Remove everything. Place it back onto its surface, place a graft of course if needed, otherwise place it back onto surface and stitch that entire area up. With lasers we don't have a stitch, we don't have a cut, but we're able to achieve much better results than we would see with traditional flap surgery. The main reason being, with flap surgery, the gum that is there, because we've opened it and once we've closed it, it falls back. See, gum is a soft tissue, so it's basically hanging free flowing. Right? So it needs something below to hold on to, or it is holding on to a structure which is there below. The structure which is there below is the bone. Now when there is no bone, periodontitis basically means where the bone has gone away. This thing, the gum previously is just hanging on over there because of the inflammation. The minute I open it up and then close it, it will follow the contour of the bone which is there below, thereby creating a large amount of gaps between the two. So aesthetically very compromising. It's a very compromising procedure for especially younger people. And off late, what I have seen in the last couple years is that more and more younger people are coming up with periodontal conditions, largely because of the kind of food that we are eating.
Yeah, right. So this is more accurate?
Very accurate.
More efficient?
Absolutely. So if you want to dwell a little more into the scientific aspect of it, your regular scalpel, that is your blade, which we use to cut our tissues, will go up to about 300 to 500 cell thickness. So when we are talking about cutting, or in very scientific term, when we are cutting anything, we are talking about the number of cells which are there inside the body. So how many cells does it cut? So regular flap, that's your scalpel, will go between 200 to 500 or 600 cell thickness is what, with any, even a small incision that you make. When you have a cut in your hand also, that is the amount of cells that you're going to cut into to actually achieve a bleed. But with laser, we have a precision of about 30 to 50 cell thickness. That is all we need to go in. We're able to achieve that. So basically, in terms, what it means is that I've got point A that I need to target point A. I will target point A along with just 20 to 50 cells around it.
Not 200.
Not 200 or 500 cells around it. So it's more precise, thereby reducing the post-operative. So doing procedure is one, and having the patient going back and going through all the struggles after the procedure is another altogether different ball game. So we should ensure, at least with lasers, we are able to ensure that the kind of post-operative pain or the post-operative swelling that we see is much reduced, or almost nil, you can say.
Oh, that's amazing. Where does laser dentistry be more effective than traditional dentistry?
All right. Laser dentistry specifically can be very effective, like I said, in cases of something called as tongue ties. A lot of people are not aware, even adults. Yes, we do tongue ties for neonates, that is just newly born kids as well, to help them suckle. But we do have cases, slightly older people, say in the 30s and the 40s, who do have a lisp, who have slight difficulty in speaking certain words, but have never realized or have never been diagnosed with the fact of the tongue being tied. Not completely, it's called as a partial tongue tie. Alright, so with surgical cases like that, where we can relieve a tongue tie. Especially with nowadays, we are observing a lot of kids who are forced to get orthodontic treatment done, that is your braces. Another reason, again coming down to it, is because of the fact of the kind of food that we are eating, and also the evolutionary pattern that we are seeing, wherein the bone, wherein your the jaw or the skull is kind of changing its shape. Previously, we needed the wisdom tooth, it had enough space to accommodate the wisdom tooth. Now we're not having. So there is, the apes had much bigger skulls, now we're having much smaller skulls, thereby not able to accommodate all our teeth. Alright, and given the fact of given the fact that we are eating, our eating patterns have changed, kids are not erupting their teeth the right way. Right? Teeth aren't coming out at the right time. The pattern with which, like say at 6 if we were supposed to get a teeth, now it's getting slightly delayed. These are the kind of things that we're seeing, clinically correlated, and we can see that in the clinic. So when we are going ahead with orthodontic treatment, we do see something called as a frenal attachment. It is basically a tissue which grows between the lip and between the two central incisors, upper two front teeth. Okay? So this muscle further causes spaces between the tooth. Olden days, we would be forced to remove this muscle surgically. We had to cut, we used the scalpel, take it off, bleeding, lot of discomfort, stitches. Nowadays, that's not required with lasers. We are able to excise those tissues without any kind of an effort. In fact, it's like a procedure when they get it done, go back, continue with their functions normally. Not much of restrictions in terms of any kind of food and things like that. A lot of people have small growths in their mouth, like, or even for example, there's a growth, you want to get a biopsy done for that growth. For that growth, previously, again, we would have to, use a scalpel, cut a big portion, take off that big portion, suture that area up, and say because of the bleeding. Basically, stitches always used to be placed to prevent the bleed. Nowadays, we're able to do that with lasers. So basically, lasers are used in all procedures where you want to avoid blood and where you want to avoid pain.
So for a common person, right, when I have an issue in my mouth, I'm not aware of what the problem is.
Correct.
I won't know.
Correct.
I won't know whether this needs a cut, bleed, laser, traditional method or whatever it is.
Correct.
So how do I identify that probably a laser treatment is better for me?
Okay, I think at the very start I told you, there's nothing like a separate laser treatment, and there's nothing like, it's not a new procedure that we are doing. It is an add-on to all the procedures that we are doing.
True. The reason I'm asking this question is not everybody has your laser, not everyone's specialized in laser dentistry, right? So probably I may just go to somebody who's there around me, not being aware that this can be treated better, more accurate and more efficiently if I use the laser. How, is there a way that I can identify that, okay, this problem is better to go to this person? Because the problems that you just mentioned are not something that a common man identifies.
Correct.
I wouldn't know, okay, this is the issue, which is why I have this problem.
Correct.
All that we know is something is not okay.
Correct.
So how can we get to know that?
See, if you're again asking me the same question, wherein is it that without, just because I'm using the laser, or if I'm not using the laser, am I doing a bad procedure? No, that is not, that does not happen that way, correct? Laser only adds on benefits. It basically kills the microorganisms additionally, which we can't see when we're not using it, and there's no way for us to ascertain for sure that, by not using the laser or by using the laser, but laser in itself has a property which is bactericidal, which means to say it kills all the microorganisms which are there. So as a person, if you come to me, there might be a procedure, say for example, like a cavity preparation. You've come to me with slight bit of sensitivity. We take an X-ray, we figure out, all right, this tooth can be treated with just a filling. It has not reached to an extent wherein we need to do further treatment, right? So if we are doing a procedure which just involves a cavity preparation, I would not, we do have something called as hard tissue lasers with which we can precisely cut a cavity. Like I explained previously as well, we have, like, lasers are more pointed. With your regular, drilling instrument, or the, handpiece, as we call it, when we are drilling, we end up taking off a little bit of a good portion of the structure of the tooth as well when we are doing a cavity preparation, just like that. But when we are using a hard tissue laser, we are able to do that cavity preparation without removing. Instead of removing 200 cells, we are able to remove
with 30,
50
40.
to 60 cells, we are able to manage that, wherein you are preserving more of your natural tooth structure. But then if you ask me just basically for a cavity preparation, the time that a hard tissue laser takes for a cavity preparation is much more than your regular, if you're doing it with just your regular traditional methods, right? But yes, the only advantage I see, if a regular cavity preparation done well, filled well, all the protocols followed, is going to work just the same way as we are doing it with lasers. That is when I'm talking to you about a very basic procedure.
Yeah.
Now when a patient comes to you for a same thing, the same patient has come down to me, and I have figured out that all right, we cannot finish treating him with just doing a cavity preparation. We might need to do something called as a root canal treatment. In a root canal treatment, we clean inside the roots of the teeth as well. That's one of, most often here in India, we find people coming to us only when they have pain.
True.
Very rarely do we have people who come down to us for preventive dentistry, right? So when we have people coming down, it's a 90% chance wherein we are doing a root canal treatment. When we are doing a root canal treatment, we are cleaning into the canals. Canals, if you imagine, are really minute structures, not so very clearly visible. You can't really see into the canal. It's more on your expertise and more on your tactile abilities, how we are able to clean inside your cavity. I mean inside your root canal, right? So when we are cleaning inside the root canal, we've cleaned, but it's so narrow, it's like a one-way pipe. We put everything, it just goes and stays there. There's got to be a way of getting things out. So we irrigate and get it out, and we activate this irrigation with lasers, which has more pointed. It's, you know, your laser is nothing but activated light which is going in and ensuring you're able to bring out all the microorganisms. And like I explained previously also, laser has a bactericidal effect. Basically, it kills the microorganisms. It's able to kill much better. It's able to open out. There are something called as lateral canals that we have, additional canals basically, which also have a lot of microorganisms which are there. It's able to eliminate all that. So what we've observed and what also it shows with the number of years we've used lasers, and also what it shows in multiple of our papers and studies and everything, that the success rate of a root canal is much better with lasers as opposed to without lasers. But yes, having said that, I'm not saying that you've had a root canal. See, because root canal, I would say 90% of our population has had root canal. So they don't need to be worried that, oh, we did a root canal without. Again, there all protocols followed, and if your body and systemically you're healthy and your healing is fine, you're going to be fine even without using lasers. But yes, laser has its advantage. It's a more advanced form of treatment, right, in that. Now coming down to another procedure, surgically. Like I spoke to you just previously about your tongue tie or your biopsy lesion being taken or a frenectomy. There, hands down, laser has a better advantage as opposed to your scalpel. Again, traditionally, a surgeon is always going to be happy with a scalpel in their hand. But yes, lasers do have, I mean, it's a concept where people feel laser is going to take a lot of time. No, it takes much lesser time. It's much less painful, much less bleeding. So yes, that it has an advantage in those cases. And for certain, that is why when you asked me that initial question of which case would you ideally take up under laser, gum therapy. Gum therapy, one, it's proven, established, and for a fact, lasers is the it for doing your periodontal therapies, that is your gum therapies. We are able to increase the longevity of a tooth by at least 15 years, which is great in terms of oral life.
True.
At 15 years is a good amount of time by doing lasers.
Okay. So, the use of laser is pretty much more effective, more accurate, efficient, better in every way, right? It's probably the future as well. Why is it that not many people have adopted it yet?
I started practicing laser about 9 years ago, and laser was there about 5-7 years before that as well here in India itself. I would say largely the reason for that is the initial equipment cost, which is very, very high to invest into a laser. Two, it's the expertise. People need to know and train themselves of how to use the laser. So that we've seen that not so much, but it is picking up. I wouldn't say that, say probably 5 years ago, people would not know so much about lasers. There are a lot of people who know a lot of things about lasers now. So yes, bringing it into practice takes time. It's a change which very gradually will come up into the fraternity, but it certainly will.
Okay. So do traditional doctors really need to undergo a specific training before they adopt into laser?
Alright, it's something like you're asking me, a person who, he was using one X type of software, does he need training to use a new type of software? Of course, it's a new equipment, it's a new technique that we are using, it's a different, everything is new, right? Traditionally, we have certain concepts, we are all evolving. Everything is evolving in terms of medicine. Every day there is a new thing that we can learn. See, you can use something without training, but you'll use it only to that much of aid, right? So if you need to use it the right way, training is absolutely necessary. So we have to train, any which way, we are evolving as a species. So we have to evolve as doctors as well and keep ourselves abreast.
I'll probably pick out the same example, right? So somebody who's been professionally into a lot of manual work for decades, when software came into picture, adopting to that is difficult.
Correct.
There are people who have that block, right? They don't really adopt very quickly. With similar to traditional dentistry, I'll put it across that way. Somebody who's been into this field for like say 40 years, still practicing, to adopt to something that's come up now, is it easy or is it like, is it a whole new game?
It's not very easy, but it's not impossible. It's not somebody cannot adapt, because the basis is the same human being, the basis is the same tooth, the basis is the same tissue, right? But yes, if trained 100%, any and everybody can, adapt to new change. And I feel as doctors, we are always open. Yeah, I'm not going to say anybody is going to be so rigid and say that they are not going to adapt into something new.
That question came because we have a lot of dentists around with who we've still not seen all of this, right?
Correct.
So maybe what could be the reason behind that was why I asked this question. So, all right, moving on. With the advancement and the future being laser, what is the cost going to be around all of this from the patient's perspective? Are the treatments going to be very expensive that somebody cannot afford, or is it a minimal difference?
It's a very small difference. I wouldn't say something, it's not going to be such a large thing that people can't afford. And I'm certain with the kind of economy that we are having, and people who are earning the way that they are, and the kind of boom that we are having in the entire IT sector, any and everybody wants quality, and any and everybody is ready to pay that little bit extra to get that little bit extra, basically.
True.
Right? So not very expensive, very affordable, and other than affordable, does away with so many other procedures that might be required later on, which will again cost money.
True, yeah.
This additional bit of extra paid upfront, less stress in terms of getting additional procedures, less complications.
Okay.
So not very expensive.
Could you give us a number around that extra that you're talking about?
Few thousands.
Across procedures that you're saying?
Across procedures.
Okay.
So not a very drastic, it's not like not even going to say a few 10,000s, I'm just going to say a few thousands.
Okay. That seems to be affordable to a lot of people, right? Picking out Bangalore in particular, how many places have laser treatments happening?
Across in terms of number, we would have multiple. Like I'm saying, when I started, there were like a handful of clinics. But then yes, people, like I said, people are evolving. Last 5 years, there are quite a few clinics.
Okay. Do you also deal with implants and
Braces.
corrective?
Correct. So they
corrections.
want to look nice and things like that. So a lot of people when they smile have got like gums which are very seen.
True. Yeah.
Which does not looks nice on some people, doesn't look very nice. Some people are very conscious about it and tend not to smile so much. So with lasers, we have like same procedure can be done with scalpel also. We do it with lasers. Lasers is of course better because it's a surgical procedure. It comes under the surgical bracket of procedures wherein we can excise the gum.
Okay.
Remove that excess gum.
Okay.
And make the smile. So it's called gingivectomy. The procedure is called as gingivectomy. We can do gingivectomy with lasers.
In case of tooth corrections or implants, does using laser make it more efficient, better, whatever? Is that better when you use laser or doesn't matter?
See, placing an implant, there is not much going to be much of difference. It's surgical, we have to drill through the bone, we have to place the laser, we have to place the implant just like that. But the stage 2, wherein we are going to place the cap. When we are placing the cap for an implant, we always have to remove a bit of tissue, surgical removal of tissue. There it will certainly help. Patient can do away with the surgical phase. He doesn't have to again go through that anesthesia, the bleed, the pain and the suture and everything. That will not be needed. We're able to do that with laser. And if you're asking me in terms of correction of
smile correction,
see, you have two ways of answering that. Smile correction, one, if you're asking me for braces, does laser help? There are a lot of studies which show that it helps in tooth movement. It helps in better tooth movement. Okay, there's something called as low level laser therapy or triple LT, like we call it in our jargon. Okay, low level laser therapy helps in better movement of the teeth. Okay, so it moves better, so your results are faster. There are theories, but I would say not very tried and tested out theories. Theoretically, yes. Practically, to be seen yet.
So, what are the challenges that people face if they were to adopt a laser treatment from a dentist?
The challenges that a patient is going to face. All right. So, ideally, if you look at it, there are more pros than there are cons for using a laser. The pros we've already spoken about at length. The con with a laser, the only thing that I would say is that we'll have to be of utmost, we have to take utmost care of the eyes. Right, so lasers, they affect the eyes and the cornea in a really bad way. So as a practitioner, we have to ensure that we're giving him the right wavelength, curating or cutting glasses, so that whenever we're doing a procedure, the dentist, the assistant and the patient wears glasses to prevent any kind of damage to the eye. Other than that, I don't see any kind of an effect or an issue a patient will encounter with lasers. In terms of how a clinician needs to take care, I would say we need to have a very separate chamber for it. We'll have to ensure that there is not much of movement happening into it. There should not be anybody who just suddenly enters into the chamber when we are operating. Again, the only effect being the effect to the eye. We do not have any other kind of documented effects to a patient. Yes, of course, that's where the training comes into play. You're trained well, you will ensure you've worked well and not cause any kind of collateral damage when you're working on the tissues. But other than that, no other effects that are going to be there for the patient. No.
Okay. So, can this be adopted by pregnant women?
Absolutely.
Senior citizens?
Absolutely.
Children?
So we have used laser from neonates to really old geriatrics and does not have, it can be used across. Does not have any kind of effect, or I would say disaffect on any of the patients.
Wonderful. Okay, so I have a couple of myths that we came across when we researched. I'd like you to tell me if that is okay or not.
True. Tell me.
Right. Lasers are just for cosmetic process.
No.
Okay.
That's a total myth. I think we've spoken again at length throughout. It's, I would say, a largely surgical tool, aids in a lot of surgical procedures. Yes, for cosmetic health or cosmetics, we do use a lot of surgical, additional surgical procedures to improve the aesthetic. Yeah, if that way, it also aids cosmetic procedures, but it's not only curtailed towards cosmetic procedures. No.
Okay. Laser treatments are too expensive.
No, not very expensive. Affordable, worth the extra amount that you're spending.
Okay. Lasers can burn or damage your mouth.
See, lasers work with the principle of something called as ablation. Yes, I would not totally say it's a myth. It does burn, right? That's how it works, and that's how it is able to, cause that surgical process or, do that specific procedure. Again, training. If you're trained, we are cutting only what we are cutting, or we are doing a procedure or ablating only the surface that needs ablation, not all over.
So it's not.
But if it is just shown on any other portion of the mouth, it's not just going to cut and break through and everything. But then yes, it's not going to affect in such a fashion. But then yes, coming to this question, I understand from where these questions come. So if you want to go a little into detailed history of lasers, there used to be something called as carbon dioxide. I mean, lasers have gone through a lot of evolution through the years. Even we've got better and better equipments coming as the years are going by, right? Previously, we used to have something called as carbon dioxide lasers. That used to be one of the most aggressive form of lasers. That is where you would have heard this, that it's going to cut through the mouth and things like that. Because that you need to be extremely, extremely careful of how, where and who is using that laser, carbon dioxide laser. But nowadays, with technology, the advent, we've got something called as diode lasers, pretty forgiving lasers, does not require so much of additional precautions and everything. But then yes, again, the right tool in the right hand works the right way. So training comes back onto that.
Okay. Laser dentistry is still experimental.
No, it's laser dentistry started in the early 1980s.
Yes. 40, 50 years almost.
Yes.
Okay. I wonder why it's not so popular.
See, everything takes a bit of time. See, anything new is going to be rejected by any and every fraternity. Not everybody is going to be acceptable or adaptable to that change. It takes years for that change to, get adapted, come into.
Okay. You've answered the next one, but I'll pick it up specifically again. You don't need special training to use lasers.
You absolutely need special training to use lasers. Right instrument, right hand, right outcome.
Absolutely. How early should a parent bring their child for a dental checkup?
All right. Bring a child for a dental checkup, I would say by 6 to 7 years of age, wherein we have a large amount of deciduous teeth or milk teeth in the mouth, and we've just started having your permanent teeth coming, which will be your 2 upper and lower central incisors, and your first molars, which have started coming out. Okay. However, if you ask me from when should you start oral hygiene from in a child, I would say from the time the child is suckling. From the time the child is suckling, we have to ensure that the milk remnants do not remain in the mouth, because most of us have the habit of feeding the child and putting the child to sleep just like that.
True.
So ideally a wet muslin cloth needs to be rubbed on the gum so that the teeth which erupt do not have decay, something called as nursing bottle caries.
Okay.
So oral health starts very, very young. But then yeah, the first time to visit the dentist, I would say 6 or 7 years should be good.
And how often?
Ideal often for a child would be every 6 months. However, yes, at least once a year a visit is always good, because with that we can do something called as prevention rather than trying to cure.
Okay. What are some of the red flags that parents have to observe, identify and bring them to a dentist?
Alright, first and foremost, I always believe that a child, their teeth needs to be brushed by their parent. However well it is, the kid's not going to brush his teeth on his own very well. I'd recommend a parent brushing a kid's teeth until the age of 9. That will be like a mixed dentition stage. And if you ask me a red flag, so if the parent is brushing the child's teeth at least once every day, brushing twice a day is mandate. But yes, at least once a day, if the parent is brushing the kid's teeth, they'd be able to observe any kind of black spots in the mouth or any kind of bad breath in the kid's mouth or any kind of redness in the gums. These are things that parents can very easily see.
Okay. Okay. How would you like to guide parents on daily oral health for children? What are the mandates?
Very, very simple. Brushing is like the basic necessity for every kid. I don't really recommend flossing in very small children, no. Basic brushing, twice a day brushing, very essential. That's all.
it.
Yes, of course, we shouldn't miss, doing a tongue cleaning and brushing. That's about it.
Okay. Baby teeth don't matter, they fall out anyway. Is a general notion that parents have, right? Maintaining oral hygiene on baby teeth, how important is it?
Very, very essential. See what happens, baby teeth basically act as a guide for the permanent teeth to come out into its right place.
Okay.
So if the baby teeth is decayed and this decay has reached up to the root surface, the chances of the permanent teeth getting infected or decayed even before they are erupting is very, very high.
Okay.
So it's always essential that we are ensuring that the milk teeth or the baby teeth are maintained well. It's not that the permanent teeth come out of thin air. Permanent teeth or your teeth which are going to stay for life are already there inside the mouth, just below the baby teeth. So if there's an infection in the root, there's always a chance of spread below.
Okay. Does the oral health for a child depend on the kind of food that they eat?
Absolutely, totally depends upon the kind of food we eat. So basically, a high fibrous diet acts as an auto cleanser of the teeth. So you've got more amount of fibers go between the teeth, help to clean the teeth. However, teeth which when you're eating a carbohydrate rich diet tends to stick onto the teeth. When there is food stuck on the teeth, tendency for it to decay are much higher because microorganism activity becomes higher on food that is stuck on the teeth. So yes, of course, the more fibers that you eat, the less fast food that you eat, less processed food I should say, the less processed food that you eat, better oral hygiene.
Okay. As somebody who's been into this field for so long, right, what according to you is a complete no for a child to eat? Considering dental health and otherwise also.
There's actually nothing which I would say is a complete no.
Really?
Yeah. So basically anything and everything in moderation should be allowed. There's nothing that is completely a no. I wouldn't say there's a complete no. But yes, brushing after eating something very sticky, brushing after eating something which is extremely carbohydrate rich or extremely oily, I would say is better. Or it's a good practice, and inculcating this practice in children from very young is better. So I wouldn't say they're not supposed to eat chocolates or they're not supposed to eat ice creams. No, they can, but they need to maintain. Brush twice a day and things will be solved.
Okay. Sugar is the only cause of cavities. Is this true?
Yes, if you ask me in a way, sugar is the only cause. Sugar is the cause for cavities for the simple fact that any and everything that we eat is broken down into sugar. So yes, but not in the sense of white sugar alone being the cause. Any form of carbohydrate, any kind of food is a cause for cavities, yes. Cause for cavities if it remains on the tooth for a very long period of time. Cause for cavities if we have not reduced the smear layer, that is the layer that forms after we eat food. We have not brushed it away, we have not kept it clean. Yes, it will be a cause for cavities.
Okay. One last question. What is that one tip that you would want to tell adults and for their children to maintain great oral health?
All right, adults, I'd start out with brushing, and most of us brush only once, so brushing twice is very, very essential. Brushing twice, flossing, very, very essential for adults because most often we observe one or two tooth missing, tooth not aligned in the right way, which tend to trap more amount of food. So water flossing, which is a new advanced way of flossing. We've got a device called as a water flosser. Flossing very, very essential. Cleaning your tongue, very, very important. Visiting a dentist once every 6 months is a good to do thing, but at least once a year is a mandate. So that something at the very initial stage can be nipped, right? For kids, they need to be, the habit of brushing twice a day needs to be inculcated. Brushing the right way is very, very important. Using the right aids to brush is very, very important. Spending the right amount of time.
What's the first thing you notice in a person? Is it really the teeth? Wonderful. Thank you so much for that conversation.
Thank you.
I am sure not a lot of people don't know about what laser dentistry is.
True. Very true.
Most of us actually visit a dentist not knowing this is there.
Absolutely.
So thank you for that once again.